This is the final amendment to the bill, which will not kill the bill or send it back to committee. If adopted, the bill will immediately proceed to final passage as amended. Mr. Speaker and members of the House, throughout my 27 years of law enforcement experience, I protected and served my community. And I stand here today to protect the most vulnerable of seniors in Central Florida and seniors all over our nation. We have a responsibility to see that seniors are not put in a position where they will have to choose between buying food or buying their medication, which was the case before the Affordable Care Act. We must resist all efforts to reopen the Medicare Part D prescription drug coverage donut hole. This donut hole requires seniors to pay full price for their prescription drugs after they reach their catastrophic threshold. Research found that because of this donut hole, seniors will put their health at risk because they could not afford to pay the prescriptions, which ultimately lead to higher health care costs. Because of the Affordable Care Act, this donut hole is being completely phased out of the Medicare Part D prescription drug program by the year 2020. Since the ACA passed in 2010, closing the donut hole has saved our seniors more than $23.5 billion on their prescription drugs. We know this is working. Florida seniors enrolled in the program are now saving an average of $987 a year because of closing the loophole. We know what $987 means to the average senior on Medicare. We also know that if these coverage gap discounts disappeared, Part D enrollees would have to pay $3,725 for the time period they are in the donut hole. This $3,725